Hello, my name is Erica Pine, and I will be presenting on Louisiana's preterm birth rate. Preterm birth is the delivery of an infant before 37 weeks gestation. Delivering an infant prior to 37 weeks may lead to poor health outcomes or infant mortality. Preterm births may be caused by behavioral habits such as smoking, substance abuse, medical conditions such as infections, hypertension, diabetes, or previous history of preterm birth. Lower socioeconomic status, racial and ethnic disparities also puts a woman at risk for preterm delivery. Over the past several years, preterm birth has declined across the United States. However, even with its decline, Louisiana is ranked second highest in preterm birth rate and has received a grade of F from the March of Dimes. Louisiana has approximately 18% of its population living below poverty, and 70% of the state's births are born to those who receive Medicaid. Louisiana has racial, ethnic, and social disparities which have resulted in high-term preterm birth rates that are associated with infant morbidity and mortality. This map shows the life expectancy of a child living in New Orleans area versus those living in surrounding areas of higher socioeconomic status. Smoking, drinking, obesity, poverty, violent crimes account for the disparities across the neighborhoods. When you examine other cities who have also received a grade score of F from the March of Dimes, you will note some similarities. These cities are also poverty-stricken areas and have racial, ethnic, and social disparities. Cities such as Cincinnati, Ohio, Detroit, Michigan, Newark, New Jersey, Memphis, Tennessee, Jersey City, New Jersey, and San Antonio, Texas. As one of the wealthiest countries in the world, one would ask, why does the United States have such high rates for preterm births? While there are a number of reasons for these rates, we know for sure that it is not because we lack the facilities, knowledge, or expertise to manage women of childbearing age and high-risk deliveries. Many of the aforementioned cities have notable areas of poverty, racial, ethnic, and social disparities. These cities also have areas where people are stricken with poverty and are limited to access to care. Today, we will focus on Louisiana. Louisiana's preterm birth rate is at 12.3%. Cities in Louisiana with the highest rate of preterm birth include Baton Rouge with 13%, New Orleans with 12.1%, Shreveport with 18.8%, and Lafayette with 10.4%. 70% of women of childbearing age in New Orleans area are living below poverty. Many consider their lifestyles normal and have adapted. These women lack education and support. Louisiana has several family planning and reproductive clinics available. These women need educational support so that they can feel empowered and make better health choices for themselves and their families. Why are we so concerned about these rates? We are concerned because preterm birth has a direct effect on families and society. While mothers who have premature births will suffer physically, emotionally, and financially, society is also impacted. The United States spends more than $62 billion per year for preterm births. Infants who are born prematurely face lifelong health problems such as developmental delays, cerebral palsy, blindness, hearing loss, and respiratory conditions such as asthma. The population is impacted as these children and families will be in need of financial and social support to care for these individuals for many years to come. Preterm births are also the leading cause of infant mortality rates. Yes, the rate in Louisiana has declined, as it has across the United States. The national preterm birth rate is 9.6%, and the Healthy People 2020 goal is set at 8.1%. At a rate of 12.3, where Louisiana currently stands, we should be able to reduce this rate by at least 1% per year to meet this goal. Let's look at the socio-ecological model. We can use this model as a guide to help us focus on the various components that affect one's health. From our review of this model, we understand that the health of an individual is impacted by the environments in which they live. In regards to reproductive health and prevention of preterm births, we realize that women will need to obtain early prenatal care, have supportive relationships, participate in community support programs, and obtain services that are integral in promoting healthy outcomes. In order for women to have successful outcomes, there must be some level of local, state, and federal support via grant funding programs and maternal child health policies that support women's reproductive services across the lifespan. Many of these programs are already in place, but may be limited in some areas or inaccessible to others. Some factors that may hinder health promotion for these women may involve their unwillingness to change poor habits, such as smoking or substance abuse, poor family support, or negative relationships which could lead to domestic violence issues. Some women may be unable to obtain proper health care services due to lack of community support, limitation of programs, inability to obtain an appointment for prenatal care within a specified period of time, or inability to access the limited programs in their community due to transportation issues. If community partnerships are not developed and key stakeholders are not involved, communities will lack services. Proposed interventions to help reduce preterm birth in Louisiana would include screenings for tobacco and alcohol use. These screenings will be encouraged at preconception and prenatal provider visits. Providers would then refer individuals to appropriate substance abuse, alcohol, or tobacco cessation programs. By using technology such as cell phones to provide brief risk assessments and counseling, clients can be informed of risk and consequences of their behaviors and its potential impact on their health and that of their infants. Studies have shown that women who smoke and drink alcohol are at a higher risk for delivering a preterm baby. These babies are also more likely to have developmental conditions such as fetal alcohol syndrome. Provider screenings and education of health wellness will ensure that the population served is well informed and can make educated decisions in regards to lifestyle behaviors. Expansion of prenatal programs in underserved areas is also necessary. Across the United States, it has been determined that many areas that have increased preterm birth rates, infant mortality rates, maternal morbidity and mortality rates have had service limitations. In addition, these areas are often those that suffer from lack of community resources due to their built environment. With the expansion of programs, providers are trained to work with specific population groups to ensure cultural sensitivity. Additionally, providers are encouraged to expand their service to coverage areas that have previously been left out and reduce gaps. Providing community-wide informational sessions regarding state and federal programs is also necessary. The state can expand their programs to include undocumented and uninsured persons in effort to capture those who need services but cannot afford them. The areas that we would like to target are often comprised of a population of people with limited sources and limited interaction with those who can help. It may be necessary to send volunteers and outreach workers into the community to talk to women and their families. We need to provide these communities information regarding how to apply for health insurance, inform them of the services that are available, and expand services to those in need. Evaluations will be done via post-intervention surveys and questionnaires, pregnancy risk assessment monitoring surveillance, behavioral risk surveillance systems, ongoing community research, assessment, and evaluation, and community door-to-door surveys for the uninsured and undocumented individuals. Evaluation of interventions involve ongoing data collection and analysis of data to determine the effectiveness of the interventions or specific programs. Intervention evaluations ensure that the interventions are being carried out appropriately in order to obtain the desired outcome. When key players collaborate about various interventions, appropriate decisions can be made in regards to whether certain interventions are effective and what changes are necessary to strengthen program outcomes. Louisiana has a poor preterm birth rate compared to other states. Upon review of Louisiana's maternal child health programs, it was noted that Louisiana has had limited PRAMS operational activity since Hurricane Katrina in 2005. While it is known that it has taken some time for the state to rebuild, the data analysis from this survey alone would provide information regarding program needs within the state. Louisiana could then compare its programs to other states that are doing well and connect with these states to determine successful program strategies. It is important to share information, ideas, resources, policies, and create partnerships and programs that will support the health of the communities that are lacking services and support. Some of the potential challenges and barriers to implementing the proposed interventions may include the lack of community investments, poor built environments, housing instability, concentrated areas of poverty, lack of education and employment, poor behavioral choices, and environmental safety concerns such as high crime. Poverty is currently the most notable predictor of preterm birth. The state of Louisiana should address some of the policies that affect low-income populations that directly impact poverty will impact preterm birth rates. Solutions to some of these barriers and challenges involve engaging policymakers, employers, key community leaders, and health administrators. Policies can directly impact built communities is what is needed in Louisiana. Lastly, we look at a logic model. Logic models are often used to describe activities and intended outcomes. This specific logic model was created as a plan to help reduce Louisiana's preterm birth rate. This model has only a few of the many interventions that can be implemented to promote change. It is important to have key players collaborate and determine what activities should take place, develop policies, educate providers, staff, women, and the community at large. The activities will produce short and long-term goals that will eventually impact Louisiana's birth rate. As discussed earlier, the Healthy People 2020 preterm birth rate goal is 8.1. Louisiana's most recent rate is 12.3. The goal is not far-fetched. With continued support, we can successfully decrease this rate by at least 1% per year. This concludes my presentation. Thank you for your time and consideration.